Dear listeners of the Public Health Insight Podcast, my name is Will, and before we begin this week's episode, we just wanted to share a new partnership between PHI and the Canadian Global Health Students and Young Professionals Summit. The 7th Annual Global Health Student and Young Professionals Summit will be taking place virtually this October 17th, and this event will be totally free of charge for all participants. If you're interested in learning more about this event, please check out the link in this description below. Thank you so much, and enjoy the episode.
Public health is a population-based field of science focused on preventing disease and promoting health. Every week, we will be engaging in interactive discussions and analyses of the latest public health issues affecting you and your communities all around the world. This is the Public Health Insight Podcast.
My name is Will, and I'm here today with Gordon, Linda, and Sully.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Health workers have long been recognized as crucial components in a functioning and thriving society. Whether it's individuals working in a health care facility, working in home care, or on the front lines of natural disasters and pandemic responses, these individuals provide crucial services to ensure the health and well-being of the greater population. Despite their important societal contributions, the World Health Organization estimates that health workers are at high risk of violence all over the world. In this episode, we will unpack this important issue of violence against health workers, explore some of the root causes, and discuss strategies moving forward to protect our crucial health workers. Okay, so before we begin, we want to preface by noting that our discussion today will only focus on violence against health workers perpetrated by patients and visitors. In the literature, this is referred to as type 2 violence. We recognize that this is not the only form of violence experienced by health workers, and in a future episode, we will cover workplace violence more broadly. All right, so as previously mentioned, the World Health Organization estimates that health workers are at a much higher risk of violence all over the world. And so to begin, we want to start by defining a definition of health workers that we will be using throughout our chat today. So when they refer to health workers, they're talking about not only those who provide services, but also those who don't directly provide services, but are involved in interacting with patients in the overall setting. So based off of this definition, the WHO estimates that between 8 to 38% of health workers suffer physical violence at some point in their careers, and many more of them experience verbal aggression, such as threats, name calling, and things of that nature.
Yeah, that's interesting because the range that you put there, 8 to 38, it's like that's a 30% range, right? So I'm almost thinking that maybe there's some, extrapolations there because it's so widely underreported by healthcare workers or health workers that often what you hear is that experiencing violence at the hand of patients or people you care for comes with the job. So a lot of them might not even be reporting it. So that's an interesting range.
Yeah, so that's a very good point that you brought up, Gordon, for I guess the lack of reporting. And that's something that I think we'll touch upon later on. But before moving on to actually the issue of non-reporting, let's start by just kind of going through what is violence experienced by health workers. Like, I feel like oftentimes when I think of that violence, I just think, the physical attacks by patients. And from my own experience, being a patient in the hospital, I've definitely seen instances where you have an individual who might be in a lot of pain, and you can see them physically striking a nurse or a physician or an individual who's trying to calm them down.
Yeah, I think, and then you have the more kind of, unfortunately, the more accepted violence, which is kind of like the verbal abuse side, right? Because it's not doing any physical damage, and then you have the whole stigma that we'll get into about reporting later about kind of that whistleblower disciplinary thing that exists in a lot of institutions where people are looked down on for kind of sharing their experience with the work that they do. And verbal abuse often doesn't carry a lot of weight when someone decides to report that and they work for the health system. So that's another, you could call it kind of a hidden epidemic or something like that, if you will.
It's also interesting to see that the same biases in the wider society also extends within the health system and onto health workers as well. So things like stigma towards women or racialized people or perhaps somebody who has a disability, all of that health workers still experience on the job too, because it's just an extension of the biases we have in our general society. And so you can imagine if we ignore it in our everyday life, most likely it also gets ignored in the workplace because it's like, oh, well, the patient didn't mean it, or are you sure they really were saying something that was, racially insensitive, or there may be a lack of action on, at the institutional level to address these biases because it's just so embedded in our society.
We see the same issues existing in broader society, manifesting itself within healthcare settings because it is just a smaller subset of overall population, right?
Right.
So going back to that earlier point, Gordon, of reporting. So I have a statistic here. So according to the U.S. Occupational Safety and Health Administration, up to 75% of the nearly 25,000 workplace assaults that have occurred annually in healthcare settings, only 30% of nurses and 26% of emergency department physicians actually reported these incidences of violence. So this issue of underreporting, what do you guys think might be some of the factors?
I think part of it could definitely be just the idea that this is part of the job. I signed up for this. If I'm in the ER and my patient assaults me, they can't be held responsible because they are vulnerable, they're sick. I'm in a role that's supposed to be helping. And so you could just brush it off as just part of the job.
Yeah, you can almost say that it's pretty much part of the work culture to expect these kind of things like on a day-to-day basis. And like, if, one talks about it, it's like, yo, what are you doing? It's
right.
We all expect this.
Yeah. And another thing too, I've seen from, there's some research that involved kind of carrying out focus groups. And one of the themes that emerged was, healthcare workers swore to take an oath to protect any patients that they see. And, they might feel that by, reporting any issues of violence in the workplace perpetuated by their patients, that they might somehow be getting them into kind of trouble. And, we focus on, in healthcare or other kind of professions, we focus on empathy. So, if we're very, empathetic, if nursing and healthcare is a very empathetic driven profession, it discourages people from kind of getting their patients into, legal issues or any trouble because they don't want to kind of exacerbate whatever else they're already going through. So that's a big factor as well.
And also the process of reporting, it could be very tedious, time consuming. If already in hospitals, often they're understaffed. So if you are struggling to meet resources to care for patients, how then are you supposed to take time out of your day to file a report and then meet with people and then constantly have it brought up when you're just trying to do your job? And if that process is not facilitated to be able to report in a convenient way, then it will deter people from wanting to speak up.
Yeah. And back to the whistleblower thing, I've seen stories about nurses reporting, or other healthcare providers or health staff in hospitals or primary care clinics do report some of these issues, and they kind of get reprimanded. There's some stories about nurses kind of losing a lot of their shifts all of a sudden without explanation because they reported an incident. So it seems like the system is set up to kind of dissuade people from filing formal reports. And that's a big problem as well.
So what are some of the short-term and long-term impacts that violence against health workers can have on said health workers? I'm thinking, obviously, there's the negative, the side effects of the physical and psychological and emotional abuse that these individuals might experience affecting the long-term well-being and health of these workers. For example, if things like if they're being physically attacked, it will obviously leave marks, might even leave things like scarring and permanent damage in some severe cases. And things like emotional attacks, verbal attacks, things like that can often also lead to a lot of post-traumatic stress from experiencing these attacks.
Yeah. On the mental health side of things, there's even cases of healthcare workers experiencing, panic attacks when they have to go back to the same environment, and anxiety associated based on the trauma that they experienced. And I've read too, in a lot of cases, accommodations aren't made for healthcare workers who return to the workplace after some of these violent acts. Maybe, in a certain ward, there's a particular nurse or someone who kind of disproportionately gets affected by violence. And I've heard that in a lot of cases that accommodations aren't made to kind of remove that person, since they're kind of being singled out in that environment, and move them to somewhere that they might feel more safe and comfortable. And then this obviously is going to take a toll when no one likes to feel anxiety on their way to work, right? So if you think of that from, the long-term effects of that person might end up calling in sick for more shifts, and then further leaving their fellow workers understaffed as well. And that kind of perpetuates the problem, since we're learning that understaffing is a huge contributor to why this is allowed to happen. So
I think burnout is also a really unfortunate impact of just long-term trauma and stress. And with burnout, then that would lead to, like Gordon, you were saying, taking more time off, just a lack of motivation, and then further mental health impacts too. So yeah, it's not something to be taken lightly, but we don't talk about this at all.
Going off a combination of your 2 points there, of a lack of motivation and also taking more time off. If we look further like a higher level, you can see a lot of loss in productivity, which will affect the overall strength of the sector. And I think losing this productivity can ultimately affect the quality of care that individuals might be experiencing, right? If you have large numbers of nurses or physicians or even pharmacists or whatever worker calling in sick, you have a lot of gaps in the work that's being done. It's not flowing fluidly. And
then one of the consequences of that too is increased wait times. And then when patients go to the emergency room, everybody usually thinks that their problem is kind of the worst problem in the ER, and they want to be seen as soon as possible, rightly or wrongly. So that kind of contributes to, the escalation of kind of distress in that, emergency department environment and other kind of settings in the hospital too. And, if there's not enough staffing, that's certainly going to be a problem as well.
So I think it's clear that we recognize that violence against health workers is wrong, but not only is it wrong and it should not be tolerated, but fundamentally it is a human rights issue, which infringes on a number of basic human rights that are listed in the UN Universal Declaration of Human Rights. So, for example, I think in Article 1, it says all are born free and equal in dignity and rights. And this holds especially true for whether it's a health worker, whether it's a patient. Everyone deserves the same level of respect and rights and should be treated equally. And even if, fundamentally, even if patients are experiencing pain and such, I don't think this is pain is a justification for them to abuse or attack those who are providing care for them.
Yeah, and I just want to say also, for those health workers and healthcare workers who are listening, whether you're a doctor, nurse, porter, orderly, personal support worker, whatever the case is, or just, staff in healthcare, in administration, and you come across patients, if there's anything, we left out of this discussion that you think is important to add, feel free to email us or leave a comment on our social media page. This is a very important topic, and your voices are important.
And even if you're comfortable sharing personal experiences and stories as well.
And also think Article 23 in the Universal Declaration of Human Rights is regarding worker rights, and says that everyone has a right to work, to free choice of employment, and to just and favorable conditions of work, and to protection against unemployment. Obviously, there's certain segments of that article which aligns very well with what we're discussing today, right? So just and favorable conditions of work. So for health workers, as we've discussed, the environmental context and the physical environment in which they work is very important and plays a big role in the kinds of potential risks of violence that they might experience. Right? And I think at its core, the physical environment and the systems that are in place to protect them from these risks are part of the hospital or facility. It's part of their responsibility to ensure that the setting is safe.
I want to attack that kind of the UN declaration a little bit. Nothing wrong with it per se, but I think even just in layman's terms, when you think of workplace hazards, you typically don't think of patients whacking nurses on their head when they turn around, right? You think of a workplace hazard being construction workers on the side of the highway and then the speed limits 80 in those zones to protect those workers from getting hit by a car. You think of people who work in kind of the manufacturing industry with the workplace hazards with the various equipments that they're using. You typically don't think of a hazard as the patient that you're seeing, right? So I think even the definition could be more inclusive of people who experience those dangers.
I also want to touch on that because we had talked about, I think, Gordon, you had just mentioned, or perhaps Bill, that it should be the responsibility of the workplace, like as an institution, organization, to ensure the safety of workers, to ensure that Article 23 is met. But I think in practice, it often falls on the individual worker. You take the nonviolent crisis intervention course so you can protect yourself if a patient gets aggressive, or, you ensure that you are able to lift this heavy patient so that something may happen and, you're protected. You take your days off. And so I think the onus is on the individual, and it shifts responsibility then from the system, from an organizational level, to actually change the processes that let these things happen in the first place. And then when we look at this article that, every worker has the right to work, free choice of employment, when these conditions aren't met, we often see employees go on strikes. But in healthcare, if your nurses and your doctors go on strikes, there are so many implications. So they're often limited in their ability to do so. I mean, it does happen, but they try as much as possible to prevent it with discussions with unions and going back and forth. So I think that their bargaining power is a little bit compromised because of just the nature of the profession. And so often these things are allowed to continue.
When you think of it too, when it's not necessarily preventative if someone takes a course in kind of de-escalating violence, because the word de-escalate means that there's a situation that could or is about to arise to that, and you kind of take measures and precautions to kind of not let it get worse. But how about, what is being done to kind of get these healthcare workers, remove them from those vulnerable positions in the first place? Can they be removed based on the nature of their job? Is there a way, we talk about, is it then best to just restrain every patient once they come into the hospital? What about their rights, right? So it's kind of a bit of a seesaw. You take it a little bit away from some, then you give, the rest to the other. And it's unfortunately, it's a balancing act, and I'm not sure what the answer is, but it seems like they would call it a wicked problem.
Our favorite kind of problem.
Wicked problem. Yeah.
I think the whole issue of violence against health workers, you can't really point to one single factor.
Yeah.
As with most public health issues out there, it's a multitude of factors working together to ultimately create this issue. Right? We have things like environmental factors, which we had already discussed. For example, facilities and settings being understaffed, which leads to longer wait times for patients. And as an individual who might be in a lot of pain, being told that, oh, great, you'll have to wait another, for example, someone will be with you shortly, and then shortly ends up being 3 hours. that can lead to a lot of frustration, and a frustrated patient can put the health worker at a greater risk of potential violence.
Right. And you know what adds even more stress to that situation, Will? So you go in, you're already at the emergency room, whatever country you are in, for a couple hours, and then you think you're about to be seen. Then you have 2 or 3 ambulance, they come in with, patients who they just picked up from their homes because of heart attacks. So all of a sudden then in the triage or the queue, you fall further down and you get even more frustrated that your needs aren't being met. So it's just an overall stressful environment for both the workers and the patients.
In the literature, I've also seen things such as the physical environment in which hospitals are kind of placed has pretty significant impact on violence. So, for example, things like poor lighting, a lack of security present at the facility, and even accessibility of items that patients can use as potential weapons. These are all things that need to be considered, right? For example,
right,
if you have a jar or just some item on the side and the patient gets angry,
right,
it's a first instinct grab and throw kind of idea, or even grab and hit, right? And that also kind of goes back to the idea that it's part of the responsibility of those higher up in the management side to ensure that the physical setting is set up in a way that protects those working.
From what you said, right, I think there just has to be kind of an acknowledgement or an understanding that, hospitals or other healthcare type settings is a very stressful environment, and violence is more likely to occur in there than anywhere else. And then kind of precautions should be put in place to anticipate those, because usually if you're in a hospital, it's because of some underlying condition, or you're there just to support a family member or something. Whatever the case may be, it's a stressful environment. And then with the understaffing issues and the stressful nature of the job, it's highly charged for the employees and staff there as well. So recognizing this is kind of all of these kind of interact together to make it a very highly charged, potentially violent environment. Mm-hmm. And we have to see it as such. We can't treat it as a place that's just like a restaurant or something like that. And then when you think of even this too, Will, we treat emergency departments, and we're kind of making changes to this in a lot of health systems, tend to get a lot of mental health patients. The emergency department isn't necessarily set up to treat those patients, so a lot of systems are kind of coming up with their like mental health emergency departments, right, to kind of separate the two. Like if I was in a car accident, or if I had an injury, and then the needs of someone who's going through a mental health crisis are different, right? So even just separating those two environments, so those kind of two different things don't interact, is important. But because we kind of we funnel everything into the emergency department, it's just like, and then you have the 4 hour wait times. It's a very kind of toxic environment for stress, and we have to see it for that environment that it is, and kind of create the necessary public health measures or whatever it may be to kind of anticipate and respond to those things.
I think a lot of these environmental causes of violence against health workers also kind of bleeds into health systems issues, but then just brings the issue of how do you address it. It's just like environmental factors and system factors are so difficult to respond to because it takes time, and it's complex. So but maybe we want to also talk about some of the systems issues, because Gordon, you had mentioned things like long wait times, and which would leads to aggression and leads to people getting frustrated. But that's an environmental factor, but it's like caused by systems issues.
Yeah, but then I remember every time we talk about, okay, so we have this problem. What causes that problem? Oh, it's a systemic issue. What is it? Long wait times, frustration because of that, all of that. But then, we never discuss anything further than that, because we're always at like we arrive at a roadblock when we discuss wait times, because like the system that's set up here, everybody has to wait for everyone else, triage, everybody's ranked differently, and your problem might not be as like as urgent as, you know, someone who has a heart attack. And so every time we discuss how the system is set up and like we try to like arrive at solutions to quote unquote fix it, we find it difficult to do so because of the way it's laid out.
So it kind of goes back to, I think, what Dr. Thind always would say in our you know, Master Public Health program. What is the problem exactly, right? If you can't come to a consensus of what the problem is, then you won't be able to develop the appropriate solutions to address the problem. I think, like you're saying, just getting on the same page with all the people, the stakeholders that could be involved in addressing this problem is the first step.
And I see, like, you know, I can see people arguing that the way to fix this is more investment in healthcare. You know, having more money equals more people that are hired, but I don't think that's the case, right? Because if there's a fundamental issue with how the system is functioning and how healthcare is provided, having 20 additional workers isn't going to tackle that issue. It's just going to have a bunch of additionally confused people who don't know how to solve the issue. So I think this is definitely one of those situations where, in order to fix and hopefully prevent and reduce the amount of violence experienced by health workers, throwing money at it isn't an option. It might be like a short-term option. It might be a short-term solution. For example, you know, if you're going to install a multi-million-dollar CCTV network in the setting, sure, that might prevent it. But ultimately, at its core, I think, as we've discussed, there are fundamental issues with with oftentimes the culture in these settings, where individuals feel like, one, from the patient perspective, that they're okay and that they're justified to express these violent acts against these workers. And from the workers' perspective, that it's something that just comes with a job and that they kind of just got to suck it up. Yeah.
And some of those factors, Will, that you're touching on, you know, a lot of it has to do with gender, right? Females are disproportionately more likely to experience violence in the workplace, right? And, you know, healthcare or health workers are, you know, no exception. And then when you look at even further down and you see, you know, race and, you know, racial and ethnic minorities, they also experience violence in the workplace at a greater rate than, you know, other populations. So, like you said, throwing money at the system and increasing capacity doesn't address those underlying issues.
An additional point related to social determinant side of things is even those, especially for individuals who are of a lower social economic status. And if the health system requires individuals to be paying for the provision of care,
like the United States.
Yeah, like having a patient worrying about whether they're to fully treat their condition or having to go bankrupt and sell all their possessions, kind of thing. That just adds an additional layer of
super
stress, right? It's like, do I have to declare bankruptcy in order to save my child or save my significant other for the surgery that they might need, or for whatever medications that they might require? I can't even imagine what levels of stress and anxiety it might place an individual.
You think about it too, when we, like in Canada, thankfully, in most cases, when you go to the hospital, there's no billing, right? But in the States, can you imagine too, now, you know, you brought your family member to the emergency room for a procedure, and then it didn't resolve the issue, but you still have to fork out $200,000, and the amount of animosity you might have for healthcare providers in those contexts.
Right.
Yeah. So I think that's a very good point that you brought up.
Violence and anger in themselves are like secondary emotions. So they are communicating something else. And if we're focusing on type 2 violence, which is, committed by patients and families, I think if we just start with the assumption that patients and families want what's best for their loved ones while they're ill. So the intention is most likely not going to be, I'm going to come in here and be violent today for the sake of violence. And so just recognizing that, giving someone the benefit of the doubt before something happens, if we can consider that if a patient or family member is being violent or aggressive, a need is not being met, and they're trying in whatever limited capacity they have to meet that need. And so if the first response from the hospital, the health system, is meet violence with violence, like aggression with aggression, without being able to go deeper to see what their need is, then it just keeps perpetuating it. So I'm thinking that, I think this is a limitation of the health system, but I'm thinking that, imagine if there were resources that could, like, you could sit down with this person and like address those other factors that perhaps are unable to be addressed in that one-on-one interaction. For example, is it like, are they afraid? Are they unable to meet needs? Are they in the hospital when they have kids at home and no one's watching them? Like, what are the issues that are underlying issues that are causing this behavior? And, you know, I don't know if anyone had mentioned this, but often we talk about how in our healthcare system, it's very siloed. Like, you address one issue at a time, and we don't often focus on the holistic idea of a person because we just don't have that capacity. So I wonder if expanding how we respond to these issues in terms of considering, from a holistic perspective, I wonder if that could be a more sustainable long-term solution. And instead of just saying violence and this is bad and let's just respond with, you know, more aggressive means or just cracking down, but like giving them the benefit of the doubt that people are not violent and angry for no reason, and it's not because they just want to hurt others.
It's important to recognize that whatever interventions that are put in place, it must be done in an integrated approach, you know, that considers the needs and perspectives of both the workers, the patients, but even at some level, the employers and those in the management higher up level.
We're in a society where we have finite resources. If every cause or every initiative could get all the money they need, the world would be hunky-dory, as they say, right? The issue is you either have the same amount of, you know, human resources or funding or less. That's a likely scenario. So how do we do more with less or do better with less? And that's always the issue.
I think it goes back to, Will, your point earlier about just that fundamental way our health system operates. And we don't often focus on prevention. We focus on treatment. So
regardless of the situation, whether patients are in distress and, you know, whether it was, you know, medication related or, you know, violence in any case is unacceptable. And it's also unacceptable in the work environment, whether it's perpetuated by a patient or a coworker or whatever the case is. So, well, you know, just as a disclaimer, there's in no way is it okay. I think what we're seeing with, you know, things like COVID-19, when healthcare workers go into the workplace with the work hazards now being that you could catch a infectious disease like COVID-19 and potentially get very sick or get your family sick. These people just need to be given the tools to make themselves feel safe and the workplace feel safe. So at the very basic level, I don't know how long it's going to take to get there, but that's what we should be striving for. All the healthcare workers out there, the Public Health Insight would like to thank you for all the hard work you've been doing, especially in the face of, you know, the risks that you're taking to go to work with COVID-19, in some cases not having the gear and stuff and personal protective equipment that you need to protect yourself and your family when you go home. And we also like to thank you for, despite all this, you know, stuff on social media, even by some politicians about, you know, COVID-19 being fake or you guys not being valued. We value the work that you do, and keep up the great work. And if you're in need of, you know, mental health support, reach out to your colleagues or whatever support that you're aware of. So, thank you very much for your great work.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.